Well, I think I've met many of you over the years, but let me just give you a real quick introduction. So I'm Darren Lubbers, Dr. Darren Lubbers, if you want to get formal. Actually went to high school right here, so it was really fun driving in, and they said to me, you know, where to go today, and I said, well, if you would have told me this was the library, I would have known exactly how to get here. Because back when I went to high school, it was the library. And you know, when you think about, you know, substance use prevention to me is really important. Most of the work that I do is in like actual substance abuse, you know, where people who are actually in treatment. I have a company that does big data analysis. Like we do projects in, you know, North Carolina and Oregon, all over Michigan with large behavioral health and, you know, MCOs type organizations. But I've always stayed in prevention, and that my PhD was in prevention. It was about co-occurring conditions with adolescents. It was about binge drinking, problem drinking, and mental health. And one of the things that I think has become more heightened, people are becoming more aware of mental health issues with our youth, which I think is really important. I felt like back when I did my dissertation many years ago, people just didn't want to focus on it. They just didn't think it was as important in terms of providing the right kind of referrals and counseling and having the right environmental conditions. I think that's changed. I think that mental health is becoming a bigger concern, which I think is a good thing. That awareness that we can help as a community, as a school, parents, you know, kids helping kids. You know, all of those different levels are very important. And so what we'll talk about today, and by the way, also when I was pulling in to the parking lot today, it hit me how important community norms are and how things change over the years. Like, I went to school way back, I graduated in 1980, okay, so a long time ago. But in the 1970s, back in the day, there was like a smoking part of the parking lot. Some people are nodding, they might have remembered that. Who would think of that anymore, right? And it's good that that's not a norm. That's not acceptable anymore, right? There was even some kids who were extremely upset because there was, I think it was one of the pods, but there was a smoking lounge. You remember that? You know what I'm talking about?
I do.
You do? Okay, so I'm not making this stuff up, right? And so, you know, the good news is that, you know, that's the kind of substance that has gone way down. Kids see parental disapproval as very salient, meaning like my parents would not approve of that. But back then, you know, smoking was a very acceptable thing. Like I said, teens were upset that the school closed the smoking lounge, you know? I mean, so, wow, but how norms matter, community norms, school norms, parental you know, norms, and so those things really influence what our teens do. But let's walk through some of the data and we can kind of talk as we go. So, I know some of you have seen this and have a background, but let me just sort of give you a little history here on what this information is based on. So, it's based on what's called the MiPHY, which is this profile for Healthy Youth Survey. We did this in 2017, 2018. It's our 7th graders, our 9th graders, our 11th graders who took the survey. It really asked kids questions about their substance use behaviors, violence, physical health or physical activity, emotional health, and sexual activity. And what we ended up doing is taking some of this data and comparing it to the Oakland County data set as like our main comparative numbers. And where we could, we took some of the questions from the national YRBS, which is the Youth Risk Behavioral Surveillance System, or survey as it's sometimes called, to have some national comparisons. Now, all of the questions in the MiPHY don't line up and compare to the national, which is why some are by county, and like I said, where we can compare them to the national numbers. Now, we had almost 400 7th graders, almost 300 9th graders, and a little over 300 11th graders take the survey. And what we put together for this presentation was past 30-day use, which is sort of like the big number that everybody looks at. How often have you drank alcohol in the past 30 days, smoked cigarettes, prescription drugs, things along those lines, because that's a really good kind of benchmark, okay? We also looked at things like perception of risk. Why do you look at perception of risk? It's critically important because as risk goes down, what you tend to see is use go up, you know, and so when you see, for example, back to my smoking example, back in the day, it wasn't perceived that smoking was as dangerous as it is now. So as risk goes down, you know, you often see sometimes trailing, but you see use go up. So that's one of the important perceptual variables that we always look at. And then, like I mentioned, very importantly, mental health and suicide as another couple of very important things that I know the school's already done a lot of work in that area, but as we talk through some of those things, you know, kind of, if it works, you know, sharing what you've done, you know, to kind of help with protective factors or kids who are potentially at risk, some of the things that you're currently doing or aspire to do to strengthen, you know, that kind of community awareness and ways for teens to get help when needed. Sound fair? Good start? Okay. Past 30-day use. So the blue bar is West Bloomfield. The green kind of bar there is Oakland County. Okay, so that, and by the way, it does not represent like a pure data set that's like a randomized or census view of the county. It is of the schools who participated in the MiPHY. Now, that being said, most of the schools, or a lot of the schools, I should say, do participate. So it really is our best comparative data set, you know, just looking at our Oakland County results. The other advantage of doing that is it's the exact same question. Okay, so that's helpful. Now, as you can see, what we're looking at here is the percentage of kids who said they had at least 1 drink of alcohol during the past 30 days. Our 7th graders are slightly above the county average. Our 9th graders and our 11th graders are quite substantially lower than the county average. That's really a good thing. Back to norms, right? I remember these projects that I did in Minnesota.
Audrey Gunawan, Mason Jarboa, see Mrs. Weiss in the main office.
We do these projects every year in Minnesota, and actually it was very similar in Michigan for many years, where when you try to create messages, you want to be able to say, when you're doing like a norms model, that most kids are not engaging in behavior. Most kids are doing something that you want to see more of to create a norm, right? And the problem we were having back then, some decades ago, is that you'd have more like over half of the kids drinking in the past 30 days. Okay, so it has come way down in terms of alcohol use among our youth, which is a positive thing, right? I mean, you only have 16.4% of your 11th graders indicating that they drank in the past 30 days. And how do you know there's truths to these things? Well, University of Michigan has a project called Monitoring the Future, where they've been tracking substance use since 1975. And there's been a decline in alcohol use nationally for decades now. So that is a real positive thing. Alcohol use is on the decline. So that, I would say, is a really good thing. Cigarettes. Percentage of students who smoked cigarettes during the past 30 days. Very, very low numbers here, which is an excellent thing to see. When you look at your 9th graders, they're a little below. You look at your 11th graders, they're substantially below what the county average is. And, you know, what I would attribute some of this to would be, you know, you have like very high educational attainment in West Bloomfield. And so I think that some of the parental and community norms around cigarette use would be that this is clearly a known fact that it's very dangerous to smoke, right? Now, that being said, it's still one of those things that concerns me in that when you look at the epidemiology of cigarette use. So I only bring that up in that even though your numbers are very low, what we're going to look at in a moment is the vaping problem. Have you guys heard of that? Okay. That concerns me a lot because one of the things that, back to the University of Michigan Monitoring the Future study, that they just put out into the press was that that's like doubled in the last year, the number of teens that are vaping. Clearly vaping can lead to, I mean, it's bizarre, right? The whole idea was to quit smoking, but the marketing has been to teens who didn't use nicotine, who start using nicotine, who then later start smoking. So, small numbers now with smoking, but vaping could lead to a change in this statistic. Not for while they're in high school, arguably, that they start smoking, but in their early, you know, young adulthood type years is when you start to see that sort of concern area pop up. Marijuana. These numbers are very problematic, not necessarily for West Bloomfield. When you look at where we're at, your 7th graders are slightly above the county. Your 9th graders are a little below, your 11th graders quite a bit below the county. But marijuana use is a concern area just because of the differing state policies that have been enacted. So marijuana use is one of those things that does indeed concern me. I know there's a lot of folks out there who are very pro-marijuana. I think it personally has a lot of risk to having that becoming a norm in terms of like, hey, it's okay. So I'm happy to see that your numbers are in a good place. Here's that additional concern area that I'm sure you're all aware of, prescription drugs. So what this question asks about is taking a prescription drug that's not prescribed to you, okay? And in this case, you're talking about painkillers during the last 30 days. And what's interesting here is that your 7th graders are at a higher percentage than your 9th graders, and at a higher percentage than your 11th graders. So there really seems to be something, like if I was going to do some preventive activities around prescription drugs, I might consider augmenting my efforts at the middle school level. Okay? Yeah?
Is it possible that 7th graders don't have a clear understanding of what's prescription and what's OTC?
It sure could be. Yeah. The over-the-counter versus prescription.
Yeah, I don't reading things as well. I think that was asking my parents.
Yeah. Oops. It could be, and one thing to realize about all data points in survey work is there's always a plus or minus, right? Meaning that, you know, 5.4 isn't like a true exact number. So there could be some kids in here who are misunderstanding a little bit. But it would be safe to say that your middle schoolers are potentially, you know, taking more prescription drugs not prescribed to them than compared to the high school kids, where maybe there's some education that might be beneficial at that level. Would be my take on it. Now, the other thing to be concerned about with prescription drugs, you know, in my opinion, is that, you know, it is one of those things, especially with painkillers, you know, when you think in terms of substances like OxyContin as an example, you know, that can be a gateway or lead to heroin type issues. Now, let me make sure I'm not like the scare tactic guy here. So of the people, like when I used to work in substance abuse treatment, okay, like what you often see, and the literature kind of supports me on this, so of those who become addicted to heroin, they typically started with opioid prescription drugs. Okay, so the vast majority of people who become addicted to heroin start with prescription drugs. Now that being said, most of the people though who take prescription drugs don't become addicted, okay? But what I'm saying is there are genetic risk factors, there's other mental health risk factors, and so some people can be particularly vulnerable to taking pain reliever, opioid type prescription drugs and have that have like a very negative long-term life problem for them. Okay, so it's critically important what we know, and I know West Bloomfield already does a whole lot of this, and the police department helps, etc. You have drug take-back days, you have disposal, you get messages out there to parents saying, hey, you need to make sure prescription medications are secure, you know, meaning that kids don't have access to them. All very important things. So there's two things if you want to reduce substance use in communities. One is you reduce access. You make it very difficult and hard for kids to obtain them. Those are the strategies I just mentioned. The other is through education, meaning you change the perception. You make sure that kids are aware that there's potential harm associated with given substances and that that can have a negative life outcome for them. So two-pronged approach, access and changing beliefs or perceptions through education and information. Does that make sense? And I know you already do all this, Lisa, but just sort of saying that's what we know from the literature in terms of what is efficacious. But here's the vaping thing I mentioned. Now, it's your numbers look good, right? When you compare it to the county, you know, you're lower in terms of vaping than the county. Well, you're the same in 7th grade statistically here, but you're lower in 9th grade, lower in 11th grade. But still, like I said, low numbers can still be concerning, and that the kids who are vaping are very much at risk for picking up smoking at a later point in time. Okay, so I don't think we can arguably do enough to stay at this issue of having parents in particular and school personnel, counselors, you know, the community, making sure that this sort of thing stops, you know, meaning that kids starting vaping because they think it's harmless. And I think some of the perception issues are what concerns me, you know. And are you hearing any of the same thing, that this is like a increasing problem globally with vaping?
Yes.
I don't know, I get pretty angry when I think about how these were marketed to kids, you know, with like the flavors and the, you know, I mean, it was very intentional in my opinion that these companies started to market vaping products to teens. I don't think that there was anything less than evil about how that has happened. And like I said, U of M has put out like some very alarming numbers on the national spike in terms of teen vaping. And so we need to really have awareness, information that is frankly as pervasive as we can make it regarding this. Because remember that 440,000 that I mentioned a little while ago of people dying due to lung-related diseases for the most part due to smoking? What is going to happen if this does not change, this trend, where smoking rates have come way down over the years? You know, like I mentioned when I came into the high school today, how it was like a really, you know, smoking was like okay back then. And unfortunately, those community norms changed. But the problem is that if we all of a sudden have a bunch of young people vaping that then turn into smokers, it won't be like the same thing as the opioid epidemic, right? Where it's like people are overdosing and dying in a more sudden way with the tragic results of the opioid epidemic. It's more like people start smoking, and then decades later, you end up having all of these people who are dying prematurely. And that's what concerns me so much when I see high school kids starting to vape. It's just like a huge risk factor for smoking. So I'll get off my bandwagon, but I think it's like, it's subtle. I don't know how much, if enough awareness is out there regarding this issue of vaping. I think the feds are starting to go after this a little bit more, am I right? Good, right, good. But the more we can do as community leaders, the better with this kind of issue. Oops. So remember I said, perception of risk. Huge, huge variable when it comes to preventing actual use. So here's a number in terms of the percentage of kids who felt having 5 or more drinks of alcohol once or twice each weekend to be a moderate or great risk. So in this case, you want your blue bar to be higher than the green bar, because that means your kids are more likely to think that, hey, this is a risky thing. Now, your 7th graders are a little bit below the county average, but your 9th graders and your 11th graders are above the county average. So that's a good thing. Okay, that risk level of alcohol is there. I think that's why you see your numbers so low compared to the county. You recall a moment ago, our alcohol numbers are below the county numbers. It's because of, one of the reasons anyways, our perception of risk is higher than the county numbers. Cigarettes. Your 7th graders, a little bit lower. I'd like to see that number go up in terms of perceiving a bit more risk when it comes to cigarette use. Your 9th graders are statistically the same as the county, and your 11th graders are slightly below. Percentage of students report they felt smoking marijuana once or twice a week to be moderate or great risk. Now, the good news is your 9th graders and your 11th graders are a little bit above the county averages. Your 7th graders are a little bit below. But these numbers, by the way, have plummeted compared to where they used to be. Now, for the most part, kids perceive marijuana to be risky, but as the state laws have changed, as public perception has changed, and let me give you an example of how much they've changed. Like, I help a lot of the people in the county and actually other parts of the state with their federal grants. This is what's called a 4-core measure, meaning that when you have federal dollars, you have to report it to the federal government. And within that portal where we have to enter data, okay, we have to enter this point on the perception of risk. When most of the Oakland County coalitions that have to monitor this data enter it into the federal portal, what they send back to us right away is, that must be an error. You must be entering a data point that's aberrant. In other words, they don't want to, our numbers in Michigan are so problematic, okay, in terms of the perception of risk for marijuana. Most states have perceptions of risk with marijuana that are drastically higher. And it's because our state norm has changed. The perception of marijuana and the risk associated with marijuana has gone down, okay? So what is likely going to happen is you're likely going to see more kids experimenting with marijuana as time goes on because of that perceptual change. Does that make sense? But it just tells you how aberrant our state numbers are, that you can't even enter it without having to tell the feds it's an actual true number. In other words, they think we're making errors when we enter it. So that concerns me. Prescription drugs. here our numbers are pretty good. Your 7th graders are a little below. You know, I do think back to, you know, anything that I would consider, if Lisa and I were sitting and talking through it, I'd be like, hey, keep hitting those middle schools, right? Keep getting information to them. Because that seems to be our number, whether you're talking 30-day use or perception, that needs a little augment, right? But your high school 9th graders and 11th graders are pretty much right at the county average. Your 11th graders, their perception of risk is a little bit higher in terms of the risk associated with prescription drugs, so that's a good thing. So somehow your high school kids are getting it better than your middle school kids at this point in time. Okay, so let's talk about some of your mental health and suicide data points here for a moment. And if you don't mind, does anybody have like some quick snapshot knowledge about, because I think I read when I was kind of prepping to come here today, that you've already done a lot, you know, in terms of putting it out there with suicide prevention, and I applaud you for doing that. And so I want to make sure I'm not bringing up things that have already been put in place. So have you brought in some like counseling specialists or some teams, things like that?
So yes, we have done a lot on mental health, and last year and this year we've brought in programming for our 9th grade health classes through Ryan Beal, is called Help Me Somebody. Prepare You. We've also this year, thanks to LaFontaine, we're testing a coping mechanism. We're bringing in meditation here.
Oh, good.
So 2 9th grade health classes are getting to meditate along with some teachers. It's a 12-week program. So we're trying to find ways to help kids cope better with all the stresses of life.
Yeah, and you know, and I do think that there's something to that. I think that, you know, for whatever reason, and I know there's got to be a whole multitude of reasons, but I think there is more stress out there for kids now compared to, you know, like when I was in high school. It just didn't seem like there was that same pressure, you know. Yes, sir.
I just wanted to ask you a question before we dive into the whole topic of suicide and get different from the past slides. It seems like our 7th graders have kind of a more mature attitude towards use and you know, expected outcomes of drugs and alcohol. Is that the same across different counties, across the state, the country, where the perception is lower at the middle school level than high school?
Well, it varies. It really does vary, you know. I mean, I think that when you know, there's so many regional differences, you know, when it comes to that kind of thing. It's hard to say. I think that one of the things that I would think you'd want to augment, though, would be your middle school sort of perceptions of risk associated with certain things. I do think that is a little bit lower, like we saw than, let's say, some of the county numbers. So what that means is that, you know, in and around the county, for whatever reason, kids are like perceiving the risk associated with things like, you know, cigarettes, I think was one, or marijuana, as compared to other schools. You know, and you're also seeing I mean, the trouble is the numbers are so small with actual use that there's not much there. But what you worry about, if the perceptions and the attitudes are that this isn't that risky by the time they get into high school, and we'll have to see, like when we look at these 7th graders, when they're 9th graders, well, then we'll know. Well, because if their actual use, it like pops up and it's higher compared to the county average, we'll know it's because their perceptions in middle school were, you know, not in the right place in terms of perceived risk. Does that make sense?
Well, next year's survey will be very interesting for a couple reasons. One, this is the first year we're doing MiPHY. Previously, we had done Pride. So we'll have 2 years of data to compare to each other. And especially for the mental health numbers for our ninth graders, because we will have implemented the Prepare You to all ninth graders. So hopefully we'll see a difference in our suicide numbers for sure.
Yeah,
Suicide/mental health.
right, okay, good. All right, so let's look at, first a question that's about depression. And let me caveat this. So know that this is a good question, but B, know that this single question doesn't mean these kids are actually DSM, in other words, Diagnostic and Statistical Manual, diagnosed as being depressed. This is one question, okay? But it is a good question, and so it is an indicator, okay, that you do have more kids in West Bloomfield, particularly your ninth graders. But even your seventh graders are a little bit above, and your 11th graders are exactly at the county numbers when it comes to stating that they felt sad or hopeless almost every day for 2 weeks or more in a row, that they stopped doing some usual activities during the past 12 months. Okay, so that's a fair chunk of kids, isn't it? That concerns me. So I applaud that you're putting in some things, to have kids to have resources, which sounds like some wellness type things. One of the things I would consider doing, and you probably already have counselors that have this kind of training, but the good news is there are all sorts of therapeutic models out there that are very effective for things like depression and anxiety. And by the way, when there's depression, it's like very correlated mental health issue is anxiety. Okay, and so what you tend to see in a lot of teens and a lot of schools, and you see this in our other schools in Oakland County, as you can tell, like look at our 11th graders, we're just exactly like where the county is. There's a lot of depressogenic type thinking out there. Like I said, so there's likely a lot of anxiety also. So you want to have resources available that destigmatize that kind of thing so that kids realize it's okay to seek out help. You need counselors and parents that know that there are resources out there for kids to get help with this kind of thing. And so that's really, really important, that it's okay to have these thoughts, but what's most important is to have resources available. There's all sorts of great screening tools that your counselors are probably familiar with, to be able to actually determine. And maybe it's not something the counselors in a high school can do. I'm not sure about that. There's different policies. But that at least there's places to go and referral systems available to receive treatment, okay? And these are very treatable kind of things of those who actually have depression. And like I said, don't think this percent means these kids are all clinically depressed. It doesn't mean that, okay? But it means that they have a variable here that suggests that it is a depressogenic type indicator. Is that making sense? Okay, so here's, obviously you looked at this with some previous presentations, but these are concerning numbers when you look at kids who ever seriously considered attempting suicide, with your West Bloomfield in blue at 21.8%, 7th graders, your 22.8%, 9th graders, 23.1%, 11th graders. And as you can see, now we're starting to put in some of the national comparative data. Okay, the gray bar is the YRBS, and if you recall, that's that Youth Risk Behavioral Survey, which is like the national one. And so our Oakland County kids in general are higher in terms of the percentage or proportion of kids who have considered suicide. So it isn't just the West Bloomfield thing, it's an Oakland County thing that we really need to, I think, augment our awareness in terms of this being a very serious concern area. Percentage of students who ever made a plan about how they would attempt suicide. Now, that's a concerning statement, right? Actually making a plan. So you're starting to think about it more when you're making a plan. Obviously, if you have the means, you have the method, seriously bad things can happen. So our numbers here are higher at 7th grade and 9th grade. Our 11th graders are a little bit below the county average and actually a little bit below the national average. One of the things you could consider, okay, these are things I put into place in large community mental health facilities, is there are really great national public domain screening tools. Like, have people ever heard of Columbia Suicide Severity Rating Scale? It's a national instrument. It's developed by a gal, Dr. Kelly Posner from Columbia University. And we usually put those in place because, and it was actually normed with adolescents, but like I said, it's public domain. But what's nice about that is it creates like a 1 through 5 rating scale, so you know the severity, okay? So you need to know if a kid is actually making a plan and very seriously considering that you know the subsequent steps to take to keep that kid safe, okay? And what's nice about it is they have information, the right questions to ask, let's say, that you can give to parents, teachers, coaches, administrators, so that you create a common language. Okay, so it's important to have a common language so that you don't overreact and you don't underreact when it comes to something as serious as potential suicide. So it's just something to consider, because having a common language to be able to know when you need to get that kid in a very safe place, like right now, versus making sure that they have the right other resources to talk to somebody. And they even have versions for kids to understand, talking to kids. Okay, so I like that kind of thing, but I'm a psychologist, right? And so my background is a lot in using instruments to have like a very good way to measure the level of the severity. And that particular tool I like because A, it's psychometrically, meaning it's valid, it's reliable, the metrics on it are stellar, and it's public domain, which means it doesn't cost anything other than the time to learn it. And it has all of those free information pieces that you can distribute in a community. So just something to think about if you feel that something like that would be beneficial. Yeah?
That is a strange question. Have we noticed that mental health, issues with mental health, suicide are going up as drug and alcohol use is going down? Is there some correlation with outlets?
That's a great question. And I don't know that that you can make any kind of a causal argument there, in that what strikes me is that...
Is that the trend?
What was that?
Is that the trend, though?
That mental health...
As that kind of use goes down,
Yeah.
that we see more mental health.
What you tend to see in its more severe forms, though, is what's called comorbidity or co-occurring. And what that means is a kid who, let's say, is depressed, or an adult for that matter, it's true with all populations, that a person who has a mental health issue is also more likely to have a substance use issue. Okay, so of the kids who are experimenting with substances, they're also more likely to be, especially if it's at a problem level, have mental health concerns. Okay, so, and what's different is there's different substances that come into play. Like in my world, where I work in the world of psychopathology, where we're dealing with people who are, needing some pretty significant help. Like for example, you see very high comorbidity issues with like bipolar disorder and substance use, and sometimes the theory goes that people are self-medicating, meaning that, so you see a lot of that. And there's always an ebb and flow to like the different types of substances that seem to be more prevalent. Like what you're
Or what
seeing.
you have access to, like the 7th grader won't have
Right, yeah. And I think what you're also seeing though is that, alcohol, like we talked about, has gone down, but marijuana use seems like it's popping up a bit, right? And so, and I also think that what's interesting is that, like when you look at the heroin epidemic, you don't necessarily see that as like a problem, and U of M would back me up on this, as a problem at the high school level, but it's a young adult problem. It's like we did a study in Royal Oak, and I think the median age that we were seeing there with young adults was 26. So it seems to be like in that young adult kind of thing. Yeah, right. So it's back to your access point. Now, so here's your percentage of students who ever actually try to kill themselves. And obviously these are concerning percentages. Your 11th graders are right around the county average. Your 9th graders are a little bit above the county average. And your 7th graders are a little bit above the county average. And so this does seem to be the kind of thing, once again, that I want to keep in place. I mean, do what you're doing, but if I would argue anything, it would be do more. Would be my argument to help your kids with making sure, and your parents in particular, making sure that they have resources, that it's not hard for them to seek out help. Make sure your counselors are well aware of this kind of thing, and I'm sure they already are. But one of the things that I noticed years ago, I was a professor at Wayne State for many years, and one of the things that you notice with some counselors is that they get into a groove of not necessarily being as tight with the mental health side because they become more, which is important. One of the biggest protective factors is academic attainment, but being in touch with also being able to help kids with mental health issues, I don't know, correct me if I'm wrong, but it seems like that's less of what counselors have time to do anymore. So creating that time for counselors to actually help kids or be available for kids and having specialized knowledge, I think is really important because they have the degrees and they have the background. But my question is, do they have the time available to actually be mental health counselors? And it strikes me that that's changed over the past many years. Is my perception right about that?
I think I opened that up to this.
That's right.
Yeah. Because we have school board members and the superintendent, so that would be their responses.
By the way, thinking of that, like remember I went to high school here? See, I had it rough because see, my mom was on the school board. So I had to like really be in line because, my mom was on the school board and yeah, it was, there wasn't really anything that I could get away with. Yeah.
I think we've implemented within the last year, social workers, or social workers within the district, and I think they take a lot of the brunt of what used to be a counselor's profession, part of their responsibilities, is now more of the social workers across the whole population of the school, once they're identified. So that kind of frees up some of that work from the counselor, especially now that, social worker has more of that really specialized degree versus a counselor who is focusing more on academics these days and doesn't have the same skill set.
And that's great. I mean, social workers are fantastic at being able to help with those. In fact, my daughter's finishing her MSW right now at Wayne State, and is getting that kind of specialized training and that kind of thing. And I think that having that kind of collaborative relationship with the teachers and the students and having those kind of people available is awesome.
I think for us, the main thing in ninth grade is, because ninth grade is a huge transition year.
Yeah.
And then all of a sudden, everybody's talking about classes they don't take, how many APs. I mean, it's a total stress from parents, from, everybody. So I think we're seeing different things from 9th to 11, because by 11, they're more chill about a lot of this.
I think you're right. I think ninth grade is tough. I mean, it's that transition
All of a sudden, everything matters.
Yeah. Yeah, the pressure is like big and
We don't know
crazy.
how to stick through that.
Yeah. Yes.
Sorry I'm late, but are those where you know they tried to kill themselves, or they talked about killing themselves?
What this would say to us is that this is a self-report instrument, meaning MiPHY. So these are teens saying on that self-report. So we don't have it necessarily verified, but these are kids saying that they did try to kill themselves at some point. Okay? Yes?
I want to comment on the staffing and the responsibility for noticing these things. Generally, the teachers are in a really good position if they have the strategies and know how to check in with students on a regular basis, or vice versa, students checking in with teachers. And so if a teacher becomes aware of an issue, then the teacher can refer to some of the professionals, the social workers. And so in kindergarten through grade 8, we have a program called Capturing Kids' Hearts. One of the protocols of that program is you're greeting every student every morning. You're shaking their hand, you're looking them in the eye, you're welcoming them to the classroom or the school. The principal does it, teachers do it. If you notice during that check-in period something might be different for the student, then you can make a mental note of it and then do the referral later. Now we have that K-8, and we're going to be implementing that in the high school next year as well. And so that's a small piece, but it's not a magic bullet. It's everybody trying to work together on the mental health aspect or supporting students that are struggling for whatever reason.
By the way, I love what you just said because, okay, back to my teaching days, one of the classes I used to teach was psychology for teachers. That was exactly what I teach. I'd say, listen, and you just hit two major theorists. They're both humanistic. One is Maslow and the other is Carl Rogers. And that was exactly Carl Rogers' quote. You're greeting the kids every day. How are you today? You look nice today. How are you feeling today? That kind of thing so that A, the kid knows they're cared for. But when you think of it in a Maslow kind of perspective, that old pyramid that you probably recall from psych classes, a kid isn't going to be able to be engaged in history or geometry or whatever it might be if their kind of like base needs are in a bad place, right? If they're worried about belongingness, if they're worried about, other base needs. And so having a teacher become cognizant of that kid's kind of like emotional well-being, they're that best connection to be able to do that referral you just, spoke to. And I always felt like when I was teaching at Wayne State that, because there wasn't a huge, there was a required class, which I loved, but I felt like I had to get as much into those teachers' heads about like the importance of that. And it's not hard, is it? It's like, but it's intentional of being able to say, in essence, without saying it, I care about you and I'm concerned about you. How are you? Just in that kind of greeting so that those referrals, when you know a kid is off, and there's behavioral indicators, right? Change in appearance, their grades are slipping, they're not caring about the same things. So there's something going on. There could be some mental health, there could be a multitude of things, but a teacher is one of those first, they know the patterns, okay? So I applaud what you're doing, and you're making that, sounds like a standard in the schools.
And the challenge is that the older kids get, the less adults think they need that kind of attention. And the hardest thing at the high school is, well, we have to focus on the academics, the SAT, and all of this other stuff, when what you just said is the case. If I'm coming to school and I'm messed up for some reason, it doesn't matter all of the subjects. I need to get my head in the right place and my emotions in the right place. So with the teachers, you become more subject-centered versus child-centered, the higher you are. And so we're trying to flip that. You have to take care of the social-emotional needs to get to the academic.
And that's exactly right, the social-emotional. And I think it's the same thing for parents, too, by the way. It's like by the time those kids are, getting into that 11th grade type thing, it's like, hey, they're on autopilot. They're already thinking about that kid is in college. But that are some areas where that parent needs to be engaged. Same kind of thing, right? The social-emotional connection. And you see, I don't know if you see it here, but I see it in other high schools where the parent-teacher thing drops off in high school at times. And arguably it shouldn't, you know what I mean? It's like you really need to stay engaged. You know, I know I'm running out of time, so let me hit one last couple of things. I'm going to skip a few slides. This one is percentage of kids who actually attempted suicide that had an injury of some sort, an overdose, let's say. So the good news is these obviously percentages are much smaller. The bad news is any percentage is too high, right? Any percentage is too high. So let me jump to real quick though some gender issue things. I just want you to be aware of this. So when you think in terms of, you know, like this first question of your call is about like depression type symptoms. You typically see this, right, where females are more likely to experience depression and anxiety than males. You see this in your data. You see that, for example, your high school males are at 29.6%, your high school females in West Bloomfield are at 49%. So that just tells you, you also want to have some gender-specific awareness of that it's more likely a female who's experiencing depression type things. Suicide, females are also more vulnerable here. At the middle school in particular, it's a little higher in high school. Making a plan, females are higher than the males. But here's one thing I wanted to cover real quick. Some ethnicity things. One of the things I was noticing when I was looking through your data is that if you look at, in particular here, the depression type stuff that we talked about, your Hispanic Latino kids are a little bit higher here in the percentages. So I'm also thinking, just something to think about, we'll talk about it more in April, but having some cultural type things that you can put into place where there's some knowledge for teachers, counselors, parents, that there's some things going on here in your data that maybe you already have in place, but just something to consider to talk about here, and that we're seeing some differences here with this sort of self-reported depressogenic type symptoms. And then, you know, when you look at the suicide type thing, it's the same issue here. Your Hispanic Latino kids are at a higher percentage in middle school. And then they jump ahead here. Try to kill themselves, same thing in middle school, where your Hispanic Latino kids are at a higher percentage. And same thing, Hispanic Latino in terms of actually attempting suicide. And then when you look at high school, oh, and by the way, just so you know, certain data points you see in NA, whenever you have N's that are too small, you can't report it, obviously, because then that would be something that could be tracked to a given student. So high school students, you're seeing the same thing. Hispanic Latino a little bit higher here. Suicide, ever considered attempting suicide? Making a plan, ever tried to kill themselves. You see the pattern here? So it's that idea of one of the great things about West Bloomfield, very multiculturally diverse community, but what are some of the things we could potentially do to strengthen that delivery of culturally capable counselors, teachers, things along those lines, that we could do as much as we can to understand, are the kids hearing us, getting the information in the best way? Yes?
So, I know this is statistically correct, would assume that other factors such as income are fresh are normalized, so that it's not affected by income, because a lot of our Hispanic Latino families are very low income. So I wondered if that would be a factor that was normalized.
Well, with this kind of survey, it's not like, you know, we're taking socioeconomic, it's not like we have that kind of thing that's taken
We
into
don't have that
account.
data.
Right,
Yeah.
we don't.
Okay. So the kids don't say how do you perceive your economic
Right.
standing or anything, so it could be, okay.
But it could be, and so, I mean, and that's back to, you want to take into account any kind of social determinant issue that could be in place too. That's definitely something you want to be well aware of. You get back to Maslow, you sure do, absolutely.
Darren, I
Yeah.
have a question. When I first started practicing social work 100 years ago, schools had school-based support groups. So they had for kids of parents getting divorced, they had grief and loss, they had mental health. They don't have that anymore. Would that be something that could be a protective factor for these types of kids?
Absolutely. Yeah. You know, I think it's about like having as much kind of support and acknowledgement that we're here to help, you know, or support whatever people are going through, and having kids never feel judged or feeling as if they're anything but cared for. And so the more kind of support that a kid or a family has in place, I think the better.
It just seems to me that that would be a very inexpensive and easy way to support these kids.
Yeah.
We do have some like for LGBTQ, you know, there are some support groups for that, but divorce, like, I don't know if they do anything like that.
Yeah, so to sum up, because I know we got to go here, but let me just say a couple of summary things. So the idea, my take on your data is your substance use data is very low. The mental health stuff I would focus on. I would most definitely strengthen whatever you can at the middle school level, though, where we are seeing some differences with the substance use perceptions and some of the use numbers. Even though they're small, they're a little bit higher than some of the county averages. But the more you can already build on the great foundation you've already established in terms of mental health, I think the better. And so, and it sounds like you're already doing many of those things, so I really applaud that. I'm not in any way saying, hey, you're not doing a lot, you are. But I'm saying the numbers clearly show all of the ideas that were brought up. I would say, yeah, go for it. I would consider doing something, you know, in terms of having a community like that Columbia instrument that I brought up, where it becomes a common language and you could actually look at the severity of a potential kid who's truly thinking about suicide. You really need to understand the level of severity, the level of risk. So things like that are evidence-based, public domain, and they might help. Yes, sir.
I was just curious, is your presentation available online, or could you share it with the school district so that, you know, the entire board and whoever else here would like to share with you?
Yeah, I mean, that's a Dr. Hill and Lisa kind of thing. It's like I have my team, I have a whole, I'm a lucky guy, right? Back in the day, I used to have to do this kind of data, but I have a whole team of statisticians who work for me, so they just grade this stuff and boom.
Ken,
But it's your data.
Yeah,
you know?
I've sent the stuff to Dr. Hill and to Deanna, and they have it all.
Great, thank you.
Yeah. So that's it. I'm sorry to keep you guys over. I tried to fly through some of those, but I think a lot of it was covered in that, you know, you saw the same pattern going through, so I don't think we missed anything.
Thank you.
Okay?
Thank you.
Thank you.